Well, thanks everybody for joining the HealthTie Open Innovation Call this Thursday. As you can tell, I'm not Jacqueline. My name is Jake Carpenter, and I help with the board at HealthTie. This call is one of the favorite things we do at HealthTie, and we try to introduce Alaskans to innovative companies in the healthcare space, and vice versa. This week we have Nikhil from Vastmindz, and they are an AI startup. And in order to give him the biggest opportunity to tell us about what he does and then leave time for questions at the end, I'm going to just pass it over to Nikhil. If you do have questions, we will have time at the end, and we can always share contact information towards the end of the meeting and make sure that everybody has what they need to reach us and him. So without further ado, thank you, Nikhil, and the floor is yours.
Thanks, Jake. Really appreciate it, and I'm so privileged to be talking to you guys from pretty much the other side of the world here. So really appreciate you guys listening to what we're up to. I'm really excited to tell you some of the things that we are working on within the healthcare technology space. We're trying to solve a pretty big problem, actually a problem that's in my opinion, existed for centuries. And everything we try and do here at Vastmindz is making healthcare more accessible. So before I dive in, I'll just give you a quick intro to me. So I myself, after graduating as a mathematician, I went on to the world of investment banking. As I actually did work on Wall Street for a while before I realized it's just not for me. And decided to, I was always involved in quite technical heavy roles. Traditionally, I'm a programmer. So I like programming computers. I know it sounds geeky and boring, but I like it. And now what we are trying to do is teach machines to extract more information about a human body non-invasively than is humanly possible. And I'm just going to go ahead and share my screen because I'm super excited to show you what we're up to. Let me see if hopefully this works and I don't run into any technical issues. So let me know if you guys can see my screen.
Yes, we can see it.
Perfect. So like I said, everything we do here at Vastmindz is making healthcare more accessible and affordable. And thankfully, we have some amazing partners at Microsoft who have been a massive help to us and helped us push us along this far in terms of research and providing us with the right infrastructure so that we can scale as a small business. But really, before I dive into our technology, I really want to underpin this idea of what the problem is that we're trying to solve. And quite simply, I think that too many people are dying of chronic illnesses. I think that this is a growing pandemic, which doesn't seem to be getting any better. And I know we're currently in the middle of COVID-19 as a pandemic, but too many people, in my opinion, are dying of diseases that can be easily prevented, such as diabetes, cardiovascular disease, obesity. I know that's a growing problem here in the UK and the US, and of course globally. And if you just look at the US in isolation of the US's annual $3.5 trillion healthcare expenditure, 90% of that is coming from managing individuals with chronic conditions. It's just ridiculous in my opinion. And the problem is, no individual has the right resources to correctly monitor their health. It's not, if I was to ask you what your current blood pressure is right now, it wouldn't be an easy question to ask unless you had the right equipment and the right knowledge as how to extract someone's blood pressure. It's not easily accessible to have that kind of information about yourself. So we're trying to change that. And we're trying to change that in the easiest way possible. And that's by leveraging, quite simply, a smartphone. So what if you could just simply look into your smartphone camera and have all a comprehensive set of physiological factors revealed to you within 30 to 60 seconds. And this is really what we're trying to solve. And what we do is we look at the face of a human. It sounds weird when I say human. People find it weird, but just roll with me for a second. But we look at the face of a human, and the one of the most interesting physiological features is every time blood pulsates throughout your body, your skin changes color. Your skin changes color. Humans cannot pick that up, but machines can. And if you look at the video feed of an individual's face, we can see subtle changes in an individual's skin color, particularly around their upper cheeks and their forehead, which indicates their physiology, their internal physiology. So you can effectively say that the machines are able to see inside the human body from a distance. And that's effectively what we're leveraging here. And this is a little bit about the science behind it from a high level overview. So what actually happens is that because our skins are translucent, that means light can penetrate our skin. So this is visible light, just usual sunlight. Light penetrates our skin. And when that happens, it's absorbed by the amount of blood volume present underneath the skin. And so when that happens, but what happens is it's absorbed, which means it's refracted back out into space at a different intensity. So that phenomenon causes very, very subtle changes in the pixel values of a video feed. So if you look at a video feed, you can see various changes in the pixel values of a video feed. And within those changes is encoded what's called a PPG waveform. And for those of you who are savvy in terms of healthcare, PPG stands for photoplethysmography. It's effectively a signal that is reflected of blood, that is reflective of the blood volume changes underneath the skin. So in effect, what I'm trying to say is that by looking at someone's face, we can look at subtle changes in light absorption, which are naked to the human eye, extract those changes into a one-dimensional signal, which is a PPG waveform. And from that, we can extract real-time values for someone's heart rate, blood pressure, oxygen saturation, respiration rate, stress levels. We're already looking at more features such as core body temperature and blood glucose levels. In essence, what we're trying to say is you can look into your camera and retrieve all this information. In fact, I took a recording on my iPhone, and I'll show you what's happening in real time. So hopefully you guys can see the video playing. So what you can see here is our application is analyzing different parts of our face. It's actually broken down my face into a mesh. And you can see within a few seconds, it's already picked up my blood oxygenation level, which is 98%, pretty normal. It's now picked up my real-time heart rate, which is 65 BPM, again, normal. My respiration rate is 26 RPM is also normal. It's already picked up my blood pressure and my stress. And the blood pressure category, we categorize blood pressure from what the from what the American Heart Association's categories tell us. So normal would typically be for anyone with a systolic and diastolic of below 120 and 80 respectively. So that where you see normal blood pressure, that's based on the American Heart Association's categorization of what normal blood pressure is. So we're not making up a random figure about what we think normal blood pressure is. Stress is an interesting one. Stress we measure by looking at various peaks in the, so you can see a white signal on the screen here. Whilst it's still a little bit shaky, we actually measure stress by looking at various peaks on the signal. In essence, I can get effectively a comprehensive health risk score of how I am within 60 seconds. And if I just forward on to a second, you can see I'm pretty much at low risk, and I would deem myself in this case at low risk also. But it's not just for what if, I mean, this is quite important to know how I'm doing, but what if we want to know how individuals are doing that can't express themselves? Now, what about a child? A child can't express themselves. So how do we know if they're healthy or not? And this is us analyzing a video feed of a baby. And now for these, from what we're seeing, this baby is healthy. Their heart rate, their respiration rate, and their oxygen saturation is in line with what we'd expect to see. And this is, and a baby can't express themselves. So how do we take care of our childs? Typically hooking up our childs to a lot of expensive hardware equipment is not a particularly friendly approach, in my opinion. But we've tested our technology quite comprehensively against standard regulated devices. For heart rate, we are only out by around 2 beats per minute. For oxygen saturation, we are only out by 1.5%. And we are actually pretty accurate at detecting the peaks. And the reason why that's important is because that feeds our stress and our blood pressure algorithms. But one important thing, whilst everyone is so hyped or engulfed within this, within COVID-19 and that current pandemic, how can this relate to COVID-19? Well, really interesting, because the World Health Organization has already said that temperature screening alone is not an effective way to stop the international spread of COVID-19. However, there are 3 additional features which have become quite well known in infected individuals, and those include a higher than normal resting heart rate, a higher than normal respiration rate, because COVID-19 affects the lungs, it's a respiratory disease, and a lower than normal oxygen saturation level, typically below 94%. We actually currently use those features right now to compute a risk score based on COVID. And this is within 60 seconds. Now, we're not saying that we can diagnose COVID, but we can certainly give you an indication of whether you should either take a COVID-19 test based on physiological features that are quite prevalent for an individual who has a viral infection. So definitely not a diagnosis, but a very, very accessible way to know whether someone should definitely take a test. And of course, in this day and in this current period, definitely isolate. So that's a bit about what we're doing with COVID-19 at the moment. In terms of some of the, I just want to touch on this briefly because I do want to leave time for questions. In terms of some of the markets that we're looking at, we are actually, I never thought this would be a market that we'd be working with, but airlines, we're working with airlines in terms of, and that whole piece is around remotely conducting health checks for passengers remotely before they fly. So at the moment, some airlines have put in quite comprehensive checks at the airport, but the issue with that is passengers are being told they're not fit to fly at the airport. So what we're doing is we're allowing these passengers to conduct this test before they even get to the airport on their smartphone. It's extremely accessible. We're working with a lot of telemedicine companies, life and health insurers. We're working actually recently, we're talking with quite a few energy, oil and gas companies, and that's not particularly around COVID, but particularly around monitoring the stress of the workforce. It's of course a very labor intensive industry. And with 99.9% of the workforce being male, not a lot of them would report whether they are mentally stressed or not. And what we can do is monitor the stress of the entire workforce. So it is easily, we can easily monitor the deterioration or the improvement in stress of any individual, because when you're working on an oil rig or within a mine, being highly stressed can lead to negligence, and that could lead to a fatal error. So we're talking a lot with some of the oil and gas industries, exploring some really exciting use cases on how we can improve the stress of such a labor intensive environment. And I will show you a little thing that we're doing with the airlines, because a lot of people get confused when I say, how are we working with airlines? It just doesn't really make sense. So this is an example of if I was a passenger, I would have booked a flight, I would have checked in, but I yet wouldn't have received my boarding pass. And this is me at home, maybe a few hours before going to the airport. I could simply log on to my phone within the airline's application, conduct a fit to fly assessment, which would take me around 60 seconds. And then after that, I would be retrieved my boarding pass. And that, especially in this day and age, allows for a much smoother flying experience. It's just a little use case I did want to show, because a lot of people do get confused with that. But I do want to leave it there. I do want to leave a lot more time for any questions you might have. Our team is on the management level and advisory level is a mix of doctors, scientists, data scientists, and general entrepreneurs in the life and health and science industry. And our story is all about making healthcare more accessible. And we are using our choice of medium at the moment is a smartphone. And so we believe that we can empower every individual to maximize their health and wellness through probably a device that everyone already has. And this is our mission, and our vision is the democratization of personalized health and wellness knowledge. And that is what we are, that is what we do. This is our vision, and I hope you enjoyed that. And please, if there's any questions, I'd love to open up the floor to anyone who's curious or has any other questions about what I just talked about.
Thank you. That was fascinating. Before I open it up to questions on Zoom, there was a question in chat,
Sure.
and the question actually is the same question I had. So the question from Rebecca is, how effective is this technology for people with greater amounts of melanin in their skin, which is to say varying skin tones?
That's a great question. So if I just go back to this slide, so for darker skinned individuals like myself, we have a higher melanin concentration. Now, what typically happens is when light penetrates the skin and is being refracted back, people with darker skin tones, which have high melanin concentrations, that refracted light is absorbed. So it's in effect harder to extract these signals on people with higher melanin concentration in theory. But the way we extract these signals is by shifting the RGB signal changes into a different domain. So we are not really affected by individuals with higher melanin concentration. In effect, whether you are a darker skinned individual, lighter skinned individual, or you have a higher melanin concentration, we are not really affected by that. In theory, it is slightly more difficult. I mean, actually, when I started out the research in this field, it was harder for the application to pick up my own signals versus someone who was of lighter skinned. But now we've accounted for that. So it's a great question. People with higher melanin concentration, it would not affect our technology, just because we amplify that signal so much that even if someone does have a higher melanin concentration, it's not really much of an issue.
Thank you. That's a great answer. Any questions from the floor?
I'm very interested in if a group, say an airlines or a mining company, an oil company, wanted to use this for their employees, would
Sure.
they contract with you on a per patient or per incident assessment? Do they do it on monthly? Do they buy a machine? What do they do to buy into your system?
Sure. So what would happen is that this would be on a per user basis. What would usually happen is all their entire workforce would get this application shipped to their smartphone remotely. So there would be no purchase of machines involved. In effect, we are just software. We have no piece of hardware equipment that a company would buy. It would just be a contract where they'd buy the solution on a per user basis. Effectively, if we have 1,000 individuals working in a mine for, say, I don't know, I'm just making that up. Those 1,000 individuals would get this application shipped to their smartphone. So without any touch, there'd be no touch, no physical contact. They'll get this shipped to their smartphone. From that point, they can download the application within 60 seconds. It's super quick, super hands-on. And as soon as each individual starts monitoring their health through this application, the company themselves gets a holistic overview of who may be at risk from things such as COVID-19 and who may be at risk from high stress, from a central dashboard that they can monitor throughout time. And typically what we're exploring is the workforce to take one execution a day before they either go to an oil and gas rig or they go into a mine. And that gives the organization a daily score of how that individual is either improving or deteriorating. So, and if they do see a deterioration in an individual, they can intervene early and suggest that to them to either go and get a checkup for whatever reason, or to conduct in any other kind of intervening behavior. So that's typically how organizations work. It's pretty simple. The beauty of it is that it's just software. We have no hardware equipment that we sell. So it's extremely accessible, easily deployable to anyone with a smartphone.
What's been your experience with either need for refurbishment of the program or breakdown or slips or goofs in the program?
Sorry, what do you mean by that? Refurbishment of a program?
It doesn't work. It doesn't work on, somebody wants it to work and it doesn't work that day. You simply can't get the data, and the person looks into his or her smartphone and the data doesn't go through, it doesn't work. Does that?
Sure. So
that's never happened?
That hasn't happened so far. If that does happen, we do recommend all users to have access to the internet. If they, for some reason, don't have access to the internet when they conduct the test, then they'll simply get another chance to take this execution throughout the day. It's not limited on, we are actually exploring unlimited executions per day for every single user. Because of our partnership with Microsoft, we have access to some high compute engines in the cloud, which means that we're not really limiting, especially when conducting pilots, we don't really want to be able to limit a user to one execution a day. I don't think that's really fair. I think the more executions they even take in a day would be better for them themselves. They'll have more information about themselves throughout the day, and the organization would also have more information. So if someone was in a place where it didn't work, it's not like that's their only chance to get that, to extract that data. They have chances throughout the day at any point. So we don't really tend to limit executions per day per user, if that answers your question.
Yes, thank you.
No problem.
Actually, just a quick question here, Nikhil, and follow up.
Sure.
Does it depend on cloud, or does it work fully on premise on the device?
So both. So we have,
okay.
Yeah. So we have an on-device solution and an on-cloud solution. The reason why we offer both is because with some of the pilots we are conducting, if these are big companies which already have third-party applications that are running on device within their application, they already take up quite a lot of computational power. So I'd say there's not really much room for us to stick a whole SDK for it to run on device. So we offered like some kind of distribute between running on device and in the cloud. And that's really a flexible, and really when running this in the cloud, there's, and if a company wanted to integrate our features within their application without the necessary burdens of the computational power that we demand, this can be a fully on cloud solution. Therefore, the computation is done in the cloud, not on device, and there's no real burden on the device itself. So it's flexible.
Cool. Yeah, I'll read the question that I wrote there just to include on my side. Are you commercially available where?
So
where are you approved? Yeah.
Oh, approved, regulatory approved.
Yeah, did this have to go through like software as a medical device or mobile?
It depends. It depends for the type of organization. So if we're selling into public customers, yes, absolutely, we have to go through regulatory approval. Actually, we're already conducting that journey anyway. For other companies such as the aviation industry, life and health insurers, we don't need regulatory approval because we're purely an assistive device. We are not making a diagnosis.
Correct.
Eventually, we do want to be on that path. We do want to be so confident that we can make a diagnosis remotely, and we're already planning for that journey ahead. But at the moment, what would usually happen is we've conducted enough tests to prove to the organization that they can be confident in our solution. It's just for healthcare buyers specifically, we would need regulatory approval, and we would be.
It depends on the claims.
Of course, yeah, it depends on the claims. And so we will be going for a CE marking and FDA approval in the next 8 months.
Good.
Wow, thank you. And so in keeping, I know everybody probably has a list of questions. I know I do, but we are limited to our half-hour slot. So I want to make sure, I think we have time for one more question before we close it out. And after that question, we will close it out. So thank everybody for coming. Thank you for the presentation. It's been fascinating. Before we go to the floor for a question, could you put up your contact information again in case people would like to reach out? And then, and if somebody who's on the call would like to reach out to Vastmindz, and you for some reason lose the information, you can always contact us at HealthTie, and we will hook you up. So with that, do we have any more questions from the floor? Well, I don't think we do, and I will reserve my questions for a later email. So thank you once again. And do you have any last words for us before we close it out?
No, just that I really appreciate you guys listening to me and hearing about what some of the things that we're up to. It's really a privilege for us, and hopefully if there's any way that we can make healthcare more accessible in Alaska, we'd love to help the community. And you can also find me, just in addition to the contact information here, you can also find me on LinkedIn. If anyone does want to have a follow-up chat with me, you can easily ping me on LinkedIn, and we can just schedule a call and talk about anything exploratory or anything you like, really. If you're curious, I'd just love to talk to you. So just feel free to just reach out. Please do not hesitate.
Thanks, Nikhil.
Wow. Thank you, everybody. Thanks, Nikhil.
Thanks, guys. Take care.
Thank you.
Thank you.
See you. Bye-bye.
Bye.